Hello, hello, everyone. I see attendees starting to pop in here. Hello, hi. This is our AMPED webinar on health and equity and electrification. I'm so glad you could show up. Please, while you guys are all popping in, if you could use the chat to introduce yourselves, say hi, get to know who else is attending today, that would be great. We are going to start in just a couple minutes, just so we have time for everyone to sort of filter in. But if you could use the chat and let us know who you are and talk to some of the other people who are attending, you can do that as well. Oh, also, we have some time at the end for questions, but there is a Q&A section. If you're familiar with Zoom, you should know that there's a Q&A button that you can use. Go ahead and drop any questions you have in there. If you put it in the chat, we might not see it. So just go ahead and put it in there and we will look at it when we get to the question section at the end. Hi, Claire. Hi, Evan. Hey, how are you doing? And Katie, hi. Stephanie, hi. All right, again, we are going to be starting in just a couple minutes. Oh, apparently chat was disabled for a minute. You should now be able to hop in chat. So yes, if you want to hop in chat and go ahead and introduce yourself, maybe say hi to some of the other attendees, let us know who you are, what organization you work with. There we go, I see them coming on in. You can do that for a minute or two. About in one more minute, I'm going to start going through the rest of the slides. But just so you know, there is a Q&A section as well. So if you have questions for the panelists or the presenters, if you would please drop those in the Q&A rather than putting them in the chat where they might kind of get lost. Also, anyone who's participating today will get a recording, PowerPoint slides, and a survey link. And the recording is also going to go on the YouTube channel. And also there'll be a very short survey at the end of the webinar that we just use to measure the success and make sure that these are high quality and great uses of your time. So you should see that as you are leaving at the end. All right, this is hopefully going to be a great lunch hour. Let's go ahead to the next slide, talk about the agenda a little bit. So today we are going to be going over what AMPED campaign is. Then we're going to have 3 presentations, one on climate justice, one on renew, and one on equitable rate design. Then we'll have a Q&A, and then we will talk a little bit about other AMPED resources, and we'll send you guys back to work. We are going to have 3 great presenters today. One of them is, let's go ahead to the next slide. There we go. One of them is Valerie Liu. She is a board member of the Climate Solutions Accelerator, and she is also assistant professor of emergency medicine at the University of Rochester Medical Center. She is working at the state and national level on introducing planetary health as like a core concept in the medical school curriculum. So lots of great stuff coming out of the work that she's doing. Elizabeth McDade is the Renew program director for the Rochester Area Community Foundation. So we're excited to have her talk. She's been working in advocacy and social justice and education for over 20 years, and she's involved with the Coalition to Prevent Lead Poisoning, and she completed the Yale School of Public Health Certificate Program in Climate Change and Health. So she's going to be talking about some really interesting educational stuff for us. And then Mike is the principal in the Carbon Free Buildings program at RMI, or the Rocky Mountain Institute, and he's going to be talking about rate and equitable rate design. So it's really exciting, interesting stuff. So our goals for this session are to understand the connection between fossil fuels, air quality, and public health, learn about tangible health incomes driven by electrification projects, that's what we're all about, and learn how these systems are designed to support the most disadvantaged and how that improves everyone's health. So AMP's goal overall, the AMP campaign's goal, is mitigating the impacts of climate change by reducing carbon pollution caused by fossil fuels through the promotion of beneficial electrification in the Genesee Finger Lakes region. And we are funded, we're a co-funded organization by the Climate Solution Accelerator and by Greater Rochester Clean Cities. And, so we couldn't provide this essential information to you guys without that support. So thank you so much for that. And we also have our steering committee. Big thanks to our steering committee and to our other creative partners for all their help in organizing all of these. So yes, now we will hand it over to our first speaker, Val Liu, MD. Thank you so much, Val.
Yeah, thank you for that introduction, Andre. Always good to see your smiling face. And I'm really chuffed to see the wonderful participation we have today in this webinar as well. Let's move on to the next slide. So today I'd like to start a conversation amongst this group here and in everyone's heads about this concept of climate justice. So I think everyone who's online today has probably heard something about the climate crisis. My hope is that we'll bring this conversation from crisis to this concept of justice and start thinking about this big global problem as something that we can take bite-sized chunks out of with local solutions. So pretty ambitious in 13 minutes, but I'll see what I can do. All right, next slide. So on the climate crisis front, this is kind of old news. So the world is getting to be a warmer place. Decade by decade since the 80s, there's been a consistent uptrend, with 2020 being the second warmest year on record. I think 2022 was maybe 5th or 6th, but in general, with some minor fluctuations, this is what's happening. Next slide. And I think it's also unequivocal that this change has been due to us, to humans, due to the greenhouse gases we emit through industry, through travel, through manufacturing. If you look at what the trend would be without humans, it doesn't have quite the same trajectory. So this is something that was brought on by what we do. Next slide. So this can start to be very panic-inducing and scary. You look at the world and, it seems like the world is on fire, and the planet that we started with is not the planet that we have here today. Next slide. And the same thing's also happening with human health. So it's not just that this is a out there in the future problem. We're actually already seeing health effects from climate change on our bodies. Next slide. And this is actually something that was brought home and really studied closely in the 4th National Climate Assessment put out by the executive branch of the US government in 2018. They put out a whole report on the US's vulnerabilities, their strengths, and what's happening right now in our country due to climate change. And in chapter 14, it talks about human health. Click next. So this is a pretty bold statement, but it's a very clear statement. The health and well-being of Americans is already affected by climate change, already being affected. So it's not a problem in just low-lying coastal areas. It's not just a problem in overcrowded developing nations. This is happening in our homes, in our neighborhoods, in our communities right now. Next slide. So I'd like to bring it from the US even closer to home, to Rochester, the beautiful city that we live in. Next slide. And my special little nook in Rochester is the University of Rochester Medical Center, specifically in the emergency department. So I hope none of you guys have had to come to the emergency department, because that means you're having a bad day. Because because we take care of people who are sick, people who are injured. And I've been working in this emergency department for over 10 years now. And it has been my introduction to the Rochester community and all the good that and the bad that happens in this city and in this county. And I work with a wonderful team of emergency medicine doctors and nurses and techs, environmental services, supply people. It takes a huge team to run this place. And it takes a lot of dedication, but then we are privileged with an insight into our community and what happens on a day-to-day basis that I think very few people get. So I feel very privileged. So I'd like to take some of my insight as a physician and talk to you guys about climate change and how it affects your health. And some of these connections can be complicated, and they can be not terribly intuitive. So I'm actually going to use a method that I use with our students when we're introducing complex relationships and concepts. And I'm going to talk with case studies. All right, next slide. So this is kind of like a connection between climate and health that is a good way to start sinking your teeth into it. I know it's this, if you're on a big screen, this is probably very off-putting. And a lot of you probably recognize what you see there on the left. That is a deer tick, an engorged deer tick that has been sucking your blood. And this is something that is very interesting because when I started practicing medicine in Rochester in 2012, I think, Lyme disease was really rare. You almost never saw it. It was one of those things where, like, if you saw a case, you presented it in conference and you talked about Lyme disease because it was just not, it wasn't endemic here. Bring that to this past summer, and I see Lyme disease cases or suspected Lyme disease cases like several times a month. So, you know, this rash that you see on the right is the classic targetoid rash. And the reason that's happened is manyfold, but it has to do with what's changed in the habitat of these ticks. So if you look outside today, it's, well, outside my window, it's sunny, it's pretty warm, and this whole winter has been pretty warm. Instead of these ticks having to hibernate all winter long, they have warm periods where they can come back to life, eat and reproduce, so there's more ticks. There's also a friendlier environment now in the summers, warmer summers, more humidity, more ticks, more opportunities to get bitten. So this is one way in which a very direct correlation can be seen between change in climate, warmer weather, and increase in human disease, Lyme disease. Next slide. All right, so you guys seem to have grasped that one pretty well. So, we're gonna move up the chain of complexity here. This next slide is a picture of a man who is having an asthma attack. And, due to patient privacy laws, I am not going to use actual pictures of my patients or their actual names, but these are actually all cases that I've seen in the emergency department, sometimes the same type of problem more than once. And this is definitely one of those. So this man has a history of asthma, and he lives in the High Falls area of Rochester. And he had previously decently controlled asthma, but over the last year or so, he's had more frequent and more severe asthma attacks. And if you look at that picture on the left, I know it's a little hard to identify, but that's pollen. And pollen is one of the, what we call aeroallergens that's increased due to climate change. So due to there being warmer weather, longer growing seasons, there's more pollen, more types of pollen, and a longer pollen season. So those three things are all adding up to increased triggers for this man's asthma. Adding to the complexity of his case, he also lives in an area where the air quality is not as good. And because of that, his lungs are more vulnerable than someone of his makeup would be who lived in an area with better air quality. So he's already set up to have more asthma exacerbations. And then you add on top of that, due to COVID, he lost his job, he lost his health insurance, so he hasn't been going to his primary care to manage his health condition, and he hasn't been going to refill his inhaler. So he's running on empty right now. Next slide. All right, so moving on here. So this is a happy picture, but this starts getting more complex. So I'd like you to stick with me here. So this is actually, I think this is from the city paper. This is a young woman celebrating at the Puerto Rican festival that happens every summer in Rochester. Tons of fun, great festival. But what you don't know about her is, so this, again, I'm not talking directly about her, I'm using her as a stand-in for patients that I've seen, is that she actually moved to Rochester after Hurricane Maria. So after Hurricane Maria, her family lost their home in Puerto Rico, in San Juan, and were unable to rebuild. But due to having connections and family here in Rochester, she moved to Rochester along with the other, I think estimates are 8,000 to 10,000 other people from Puerto Rico who had friends and family connections here to live in Rochester, which is great. I love that our community here is a refugee relocation center and we take in all comers. But the problem is that Maria here is a type 1 diabetic, and she unfortunately was not able to bring her insulin with her or her prescriptions or her medical record when she came from Puerto Rico. So she comes into my emergency department with diabetic ketoacidosis, or basically a diabetic emergency that's life-threatening. And the reason why she ended up here was because of Hurricane Maria, a Category 5 storm that hit her territory with lots of force, wind, water, and destroyed a lot of where she lived. And there's increased incidence of hurricanes due to increased, basically energy in the planet. So increased warm weather, changing currents. And so she, although it might not be apparent from just looking at her in the emergency department, she's here in the emergency department as well because of climate change. Next slide. So this little boy, I'm hoping to illustrate us a little bit of a different connection here. He also has asthma, like the first gentleman that we talked about. And you can see he's got his little inhaler there and his teddy bear next to him for comfort. And he does have a primary care doctor. He has a pediatrician. And, he does take his controller medications, but he still struggles with his asthma because of something that his family's not aware of. His family has a natural gas burning stove from which they cook all sorts of wonderful meals and take care of him. But because he has this predisposition to asthma, the small particulate matter and indoor air pollution that's created from those natural gas stoves has caused him to struggle to breathe. And this is one of those things where the changing climate is not causing natural gas stoves to harm him, but the natural gas that's being burned in the stove is extracted from a planet in the way that's harmful. And also burning natural gas for energy is polluting and is worsening the situation of climate change. Next slide. So you can see that there's all sorts of complex connections here. It's not just about the changing climate. It's not just about the disease process. It's also about who you are, whether you're a child, an older adult, where you live, where you come from, whether you are more low income or from a community of color. That all changes how you experience climate change. Next slide. And Rochester is an interesting place to live because it is so diverse and heterogeneous. And this is one of the, I think, most interesting maps that I've seen. I'm not really like a word person, I'm a picture person. And if you look at this map on the left, you have a historic map of Rochester split up by how redlining occurred in the city. So it's a complex topic for another day, but basically there's policies in place that prevented people of color from getting adequate housing and living in certain areas of the city. If you look today at the picture on the right, that is a up-to-date modern day picture of social vulnerability. And those are things like, do you have access to good food? Do you have, housing stability? Like, do you have all the things that make you more vulnerable? And the darker the color, the more vulnerable the place is. So if you look at the green tract versus the red tract, I have a chart on the right comparing health outcomes between the least vulnerable and the most vulnerable parts of Rochester. And you can see here that depending on where you live, kind of controlling for other factors, you have higher levels of diabetes, cholesterol, stroke, mental health issues. So, this is just by proximity of where you live. Next slide. So all these people here, they're not just dealing with their disease process, they're not just dealing with climate change, but they're dealing with social vulnerability. Next slide. So this is where we get into the justice piece. So it's this concept that climate change has differing social, economic, public health, and other adverse impacts on underprivileged populations. Next slide. And if you think about justice and what that word really means at its core, it's that people deserve the same chance. And health is one of those things I think brings people together, because it doesn't matter if you are rich or poor, Black or white, conservative or liberal, everyone wants a chance at a healthy life. So to me, climate justice means that people deserve the same degree of protection from these environmental and climate hazards. And because everyone has different voices and specific priorities, they deserve equal access to decision making. Next slide. So what do we need to do? Next slide. I think you can tackle each one of these issues individually, social vulnerability, human health, climate change, but really what we're looking for is triple wins. We're looking for a way to help all these issues and look for the trifecta, the triple win. And I think this is easier to do than you might think. Next slide. And one example that I picked up, because today is a talk from AMPED, is the idea of beneficial electrification. And I have to admit, I straight up stole these slides from the RMI website, but I thought they were so good, I had to use them. And you think about beneficial electrification and what that means for health. If you can electrify your grid in a way that's equitable, you can decrease exposures to things like indoor air pollution from gas stoves. You can have less outdoor air pollution. You can help address some of these disparities in health outcomes. And if you make it affordable, people don't have to choose between heating their homes and having enough to eat or affording their medications. Next slide.
Val?
I know I'm done. I have one more slide left.
All right, just letting you know.
Ambitious to tackle all this in 13 minutes. And again, this is from RMI. There's a lot of work to be done. If you look at the pie graph that's on the left in the middle, New York State only has 16% of their homes using electric and other types of heat. We're largely fossil fuel based, so there's a lot of space for us to move the needle. Next slide. So this is a global problem, but I do think we have some ideas of how we can have local solutions, and by trying to improve the health of the people here in the community of Rochester and surrounding areas, I think we can also improve our issues of social vulnerability and start moving the needle on climate change. And I'm hoping for that trifecta. Thank you guys for your time. Sorry for stressing you out, Andre.
No, it's okay. Thank you so much. All right, next is Elizabeth McDade. I was going to tell us more about Renew. Thanks for Val for your presentation. And if you guys have any questions for Val or Elizabeth, remember, please drop them in the Q&A as we go, because we'll have a question time afterwards. All right, go ahead, Elizabeth.
Thanks so much. You can go on to the next slide. Thanks very much for inviting me today. And Val, I love that talk because it kind of teed up what I'm going to be talking about. So Renew is a collective impact program that lives at the Community Foundation. It was started with seed money from the New York State Attorney General. This is a list of our community partners, and we've got additional funding going on. You guys can see that all later on. You can move on to the next slide, please. Here are some, we work together to braid resources. So we bring together all of the different funding sources that we have to actually collectively help individuals. You can go to the next slide, please. So at this point, Renew's been around for a couple of years, and we have collectively invested over $7 million into the homes of 470 income eligible homeowners. And we do collect demographic data, so we know that our homeowners are majority women of color or senior citizens. Their average income, so we're talking about low to moderate income homeowners, and this is for a family's income, is $27,800. But we're also collecting data that shows the impact that our work is having on their fuel cost savings, as well as collecting data by talking to them about the impacts on their mental and physical health. And we are also measuring the amount of greenhouse gas emissions that are not going into the environment as a result of our work. And as of last month, that was 6,628 tons of greenhouse gas. You can go to the next one, please. So how do we do this? Partners actually, so Renew works with nonprofits that are already in this arena of doing home rehab, rehabilitation, energy efficiency work, all those types of things. We help the partners, in some cases, they have funding that will cover X and Y, but there's a necessity that their funding doesn't cover. And so we will come in and do that. But we'll also do, and they have to focus on weatherization, health and safety. But one of the things that we started doing that we think was really an incredibly useful tool to the partners was to remove barriers. So a homeowner, for example, and by the way, this has happened way more often than you might think it is, might have a non-working sewer line. So they have raw sewage in their basement, which you can only imagine the health impacts that that type of situation is creating to all of the residents of that home. Or the electrical panel isn't large enough to accommodate the high efficiency furnace that's going to be going in there. So, or there's mold that needs to be remediated. So Renew has actually worked with community partners to provide funding to remove some of those barriers to then be able to really look at a holistic approach to the work. We are not the primary funder, and it's always a braided approach. And as you can see, we've got some pretty significant priorities for the clients. You can go to the next slide, please. So again, a little bit of demographic information. One of the things I also want to underscore is while we do work primarily within the city of Rochester, there are people in need in every single town in this county. And certainly outside of Monroe County. This is just a list of some of the towns we've worked in. And as you can see, there is need everywhere. Next slide, please. Here's a quick overview of where we've gone. The cool thing is that we've worked, as I said, over on 470 projects, but our average grant is only about $4,000. So it's really a very modest investment that's being made into these homes to realize the types of benefits that we're seeing out of it. You can go to the next slide, please. So here are some case studies from our specific clients. So this homeowner was somebody who came to Renew through a U of R professor or a pulmonologist who unfortunately is no longer at the U of R, who made a recommendation to Renew to have to our partner at Pastone to have this homeowner's home to evaluated to see if there was a possibility to get rid of some of the mold that was exacerbating her bronchiolitis obliterans organizing pneumonia, or BOOP. Pastone came into the home, saw that there was the mold there, also realized that this homeowner took care of her grandchildren and that she might qualify for additional funding results. So the cool thing about Renew is the partners are also looking at all the different ways to bring funding in to actually make impacts in this home. So not only did this homeowner get funding to actually remove and remediate the mold, so her BOOP was actually stabilized, she also got funding to make her home more energy efficient, and she qualified for City of Rochester lead hazard grants. So she got new windows, she got all types of things. So not only was this individual was her home made safer, but it was for everybody else who was visiting and spending time in the home. As a result, and you can see in our little starburst there, and this is sort of going back to that the thing that Val mentioned a little bit about heat or eat, when you're looking at an 18% reduction in fuel costs, and for somebody who's trying to meet medical needs, that's a significant savings. And we also calculated the carbon emission reductions, and the result of this work will keep 42 tons of carbon out of the atmosphere. You can go to the next slide, please. Here's a homeowner who qualified for a bunch of stuff. She qualified for weatherization work, but she was going to be taken off the list for approval because she had a broken sewer line. So our community partners are not going to put funds into homes that have issues as significant as things like broken sewer lines, leaky roofs, etc. Their funding is very specific, right? They want to help this individual, but their funding only covers certain things. And the home has to also be ready to get this work done. So they came to us. They asked us for funding to help with replacing her sewer line, which we did. And then she ended up getting whole new windows. So one of the things that, when we look at the unintended consequences, right, or really the impact of thinking about the benefits of the mental and physical health of the individuals living in homes that are not healthy or safe, this homeowner had been sleeping on her couch for 2 years because her windows were broken and she didn't feel safe sleeping upstairs because she was worried if somebody broke in, she wouldn't hear them. So literally at the end of our conversation for 2 hours, she mentioned briefly that she was going to be sleeping in her own bed for the first time in 2 years, and sort of the relief that came with that. So you can see that this homeowner, it was only $17,400 that we put into this project. So again, a modest improvement to see some significant outcomes, 30% reduction in fuel costs, 60 tons of carbon eliminated. Next slide, please. This is a pretty, this one is a pretty good before and after project. This gentleman got a lot more funding through a variety of different sources. But one of the things that he told us about was the fact that he struggled with mental health issues, and the impact of seeing and getting assistance to make his home a healthier, safer place actually motivated him to do additional work that improved, again, the health and safety of his home that wasn't within the work scope, because it's not like you're going to get everything that needs to be done. This funding is always limited. And it's fascinating to see the impact that was made out of this. So not only are we talking about better mental health outcomes for this individual, 20% reduction in fuel costs, 33 tons of carbon eliminated. Next slide, please. So this homeowner actually had 3 generations living in the home. And one of the things that she complained about was adult onset asthma, and she would wake up every night coughing. So once the home was made warmer and safer and healthier, because, cold and temperatures can actually exacerbate issues like asthma and respiratory conditions, she found that she was able to sleep through the night. And not only was she sleeping through the night, she also wasn't waking up her husband, because she would do that on the regular. This home also had what was called the blanket box when Pamela's grandchildren came over. Because the house was so cold, they knew they had to get the only one they could stay in that was large enough to accommodate everybody was cold. So they would go to the blanket box to get their blankets as they were going to hang out in the room. And so one of the cool things that came as a result of this work, when you're talking about the better physical and mental health outcomes for everybody, is that the blanket box was eliminated. And this family saw a reduction of fuel costs by 19% and 23 tons of carbon eliminated. Next slide, please. This homeowner talked about this home was so dilapidated that the grandchildren of this homeowner did not want their pictures taken in front of it. And they also didn't want to be dropped off in front of or picked up from the house. And when she went to NeighborWorks to see if she could possibly get a loan to fix her leaky roof, and NeighborWorks told her that she could possibly qualify for a lot more than that, she was very, very hesitant. She was skeptical as the day is long. And one of the things that she talked about later on when the work got done was that they put a window in the bathroom. So, when you're talking again about moisture, the impact of that, mold growth, all of those things, right? But for her, it was really great to be able to go in the bathroom and not have to turn on a light. And the fact that the windows actually opened and closed, the tops and the bottoms. And so there were all these things that she was noticing in terms of how her home operated. But the other thing that she said that really choked me up, aside from the fact that she and her granddaughter and her daughter had reduced ED visits, was that she talked about the mental health impact, that, the changes were so significant to the home that everybody had better mental health attitudes about it, and that they saw that change was possible. And she saw the generational change, right? When we're talking about generational health and wealth with this type of work, this family was a really terrific example of that. Next slide, please. This homeowner had raw sewage in her basement. She also had lupus. She had put in, the slide has lost a little bit of the detail in this, but the orange section there is the amount of money she put into this house. And she had really exhausted all of her resources and was at her wit's end, and was living in a home with a broken sewer line with active lupus. And her remediation for this issue was to close pin dryer sheets to the heating grates. So when the furnace came on, the smell of sewage would be covered by the smell of the dryer sheets. So she was able to work with some of our community partners to put more work into here. And this family saw a reduction of their fuel costs by over 16% and 40 tons of carbon were eliminated. And they did not have raw sewage in their basement anymore. Next slide, please. So here are some examples. Renew has put in over 55 heat pump hot water heaters into the homes of low to moderate income homeowners throughout Monroe County. And here are just some examples of 2 of the projects. So in this case, one homeowner saved over 43, almost 44% decrease in their energy costs. 33 tons of carbon were eliminated. And this particular homeowner actually saved over $467,000. Another homeowner, 36% decrease. You can go to the next slide, please. So we're always thinking about the health and wealth of the homeowners, right? Because we do know that the impact of the home can exacerbate health conditions, and that improving heating and cooling system upgrades, et cetera, improved indoor temperatures can actually reduce health hazards. 100% of the clients that we have spoken to with pre-existing self-reported respiratory conditions report significantly reduced symptoms. Next slide, please. Great data here from Common Ground Health. I mean, one of the things that we have always talked about, because Renew comes out of the work of the Coalition to Prevent Lead Poisonings, 2 decades of work in this community, looking at a health solution with a health problem with a housing solution. We know that it's important to have the data that supports this, but also to actually get the stories that talk about it. Next slide, please. And again, the mental health impact with trying to pay your rent or your mortgage, being able to reduce your heating costs can actually reduce some of that burden. Next slide, please. Benefits: reduced air pollution, reduced heat island effects, reduced healthcare costs, neighborhood stabilization, etc. Next slide, please. So this is a great example of how, by working together, we can actually improve our community health status, transform our neighborhoods, prevent foreclosure and retain home ownership, and improve community-wide economic stability. Next slide, please. And that's it. Thanks very much.
Wow, that's all super inspiring stuff. Thanks, Elizabeth. All right. Again, put any questions you have for her in the Q&A section, and let's get right on to Mike to talk about equitable rate design.
Thank you, Andre. Thank you, everyone. If we can advance the slide. So rate design is often a confusing topic or feels complicated, so I hope to explain it in simple terms. Basically, we're talking about how we as a society and community pay for our electric system and our gas system, and how we allocate those costs to different people. So how we calculate bills. So next slide. So let me give you the overview of the process. So there's 3 steps here. The big process. First is to decide how much money overall does the utility have to spend to deliver what we need as a society, and an efficient and reliable electric system or gas system. And because they are for-profit companies, how much profit can they earn? So the state regulates this and decides what's reasonable and what's affordable for customers. The second step is, how do you allocate those costs? So if there's $1 billion a year overall, that's the cost of running the system. How do you divide that up? And usually it's split it into big categories: so residential customers, commercial customers, industrial, etc. And then there's a third step, which is often what people talk about when they say rate design, which is how do you calculate that down to the individual family, the individual business, that customer level. So everything that's on your personal or your business electric bill or natural gas bill, how does that get calculated? And so all 3 of these are important parts of rate design or rate making. We'll talk a little bit more about the third part today. Next slide. So traditionally, when people do this, everyone goes back to this old textbook. It's from 1961. There's 10 principles in here. And so when utilities and the regulators of the Public Service Commission try to make these decisions, they're often going back to this old textbook. And we can summarize the 10 principles as these 4 that are guiding how people make decisions. First, that the rates have to recover the cost. We have this system where the utility is an independent business, but it's a monopoly, but it's regulated heavily by the state. So if they need to spend on something to make the system reliable and deliver energy, they should be able to recover those costs. That's the idea, but not more above and beyond that. Second, that the rates are fairly allocated, they're not discriminatory. Usually this means that people who impose more cost on the system, people who use more energy are going to pay more rates, or people who use energy in a more costly way are going to pay higher bills. Third, that rates provide efficient price signals and discourage waste. So this gets to things that we're seeing more of today, like higher rates at certain times of day when the grid is stressed, to encourage people to shift that use to other times of day. And fourth, that rates are acceptable to customers. They can't be super complicated. They can't swing wildly from one month to the next, so people can't predict their bills. They have to be understandable and stable. So these are usually the principles, the overarching principles that guide these decisions. Next slide. But there's things are changing. The world is different than it was in 1961. And so there's new things that are causing people to rethink all these decisions. And so I've listed 4 here. There could be many more. But the first is the growing awareness of a problem that has been there, but is growing in its people's attention to it. That energy burden, so energy burden is the portion of a family's income that is spent on energy. And we often, see a goal around 6% maybe would be a reasonable maximum. But many families of lower income are spending much more than that on their energy bills and have a hard time paying. So we saw the heat or eat dilemma earlier in this webinar. And utility shutoffs. Often, there's a growing number of people who are seeing gas or electric service shut off because they're not able to keep up with their bills. So we have to manage this and deliver the essential energy services people need. Second, that electric rates might discourage electrification. So today, when we see a growing push towards electric vehicles, electric heat pumps, electric water heaters, those are going to increase the amount of electricity people use. And the way we calculate rates today has typically been trying to get people to use less electricity. So how do we balance that? We've always wanted people to use less to conserve, but now we want them to get EVs and use more, and heat pumps. The signals are distorted here. Third, that technology gives us more opportunities. So a lot of smart thermostats and EV charging, lots of new technologies can shift and optimize the electricity. So it doesn't, if there's a heat wave coming and the grid is going to be strained in the afternoon, we could cool someone's home down earlier in the day if they don't have to use as much electricity during that afternoon period. There's all sorts of new technologies that give people greater flexibility. And lastly is gas rates. So if we see that natural gas is a driver of climate change and human health hazards, and that both the state, local policy, and just the imperative to address global warming are going to push us to use less gas, or even remove families and customers from the gas system altogether, what happens if that system is in decline? How do you recover all the costs if you have fewer people paying gas bills? Next slide. So this brings up a lot of tension. There's 4 here. You could bring up the first one. So one is that utilities do need to invest in reliable systems. People don't want blackouts. People do want to shift to cleaner electricity. People want safe gas systems that don't have hazards. And we have to avoid excessive spending. And so how do you decide what is a prudent investment versus what's too much and keep rates affordable? So this is a constant tension. Next, we have these economically efficient price signals. So how might an economist set your electric rates? They might have all sorts of crazy things in there where it's dynamic, and on a especially hot day, the rates go up, or it varies neighborhood by neighborhood whether there's some constraints on the grid. But at some point, it gets too complicated, and people have to be able to understand their bills and be able to manage them. Next. As I mentioned, the goal to get people burning less gas, and so you might see lower gas use, you might see fewer gas customers in the future, natural gas that is. But as long as anyone is using that gas system, it has to be safe, it has to be reliable, they have to get their heat from it and not have safety hazards. So how are we going to recover enough money to make that happen? And last, as I mentioned, we want people to conserve. We don't want people to use excessive electricity, but we do want people to add electricity through EVs, heat pumps, et cetera. So all these make it challenging to decide how to set rates. Next slide. So a few thoughts on what would, and this is my final slide, a few thoughts on what would make an equitable energy transition, even though it's complicated, there's all these tensions, the answers aren't easy. First is certainly to expand the protections for low and moderate income families. So we know that we want to keep people's energy burden below some threshold. 6% is a common term used, but basically we want everyone to be able to afford the energy they need to live their lives. And there's various protections against shutoffs for non-payments, discounted rates for people who qualify based on their income, various incentives to help people improve their homes, as we saw in the last presentation, so that their energy can be more affordable, are great, because then we're not just relying on discounts and subsidy, but we're actually reducing the energy use. Second, on the gas system, we are seeing a push, and we do need a push to really scrutinize these gas system investments. How much are we digging up streets to replace an old gas line under the street with a new gas line, if we think that we're going to be moving to less gas use in the future? How do we pursue what we call non-pipe alternatives? What would it look like to say, no, we don't need to upgrade that pipe because a certain neighborhood is growing in population? We can do something different to keep that capacity down, or even get people off of gas entirely in a certain neighborhood. Third is that we can move more towards time varying electric rates. So this is a common trend all around the country. The value being that people who use more electricity during the highest cost times are going to contribute more to that cost, and people who don't are going to save money. Now, this has value, and it maybe it's more fair. It has value in that it gives the people another way to save on their energy bill, and technology can help them do that by doing things at different times, like charging your electric vehicle in the middle of the night. It does have a potential downside, which is that families of lower income may have less access to some of those technologies. So we need to implement it carefully, make sure those bill protections are in place. Fourth, that we find the rates that are friendly to electrification. It says evolving space on here because it's complicated to decide exactly what those are. But we've seen new ones pop up. The state of Maine just introduced a new electrification rate. There are some popping up in California. We could see these in New York State and all around the country as well, to accommodate the electric vehicles, the heat pumps, et cetera. And lastly is that because this is a big transition, it's expensive and complicated, we will need to look for outside funds. So this is maybe beyond what the Public Service Commission can do on its own, but the state or city can pursue these funds to help subsidize the transition from the legacy energy system to the clean energy system of the future. So it's not just borne through people's electric and natural gas bills. That's what I have. Thank you very much.
Thank you so much, Mike. All right, we've gotten to the Q&A. Thank you for people that have already dropped their questions in the Q&A section. If you have other questions, please go ahead and drop them in there. And let's get our whole panel on video and just be ready to unmute. Let's just set it to gallery. Let's see. Okay. Looks like we have a few questions. One of the first ones here is from Mike, and it looks like it's mostly to Elizabeth. Are any of the local programs to install heat pumps or other energy efficiency work available for renters/landlords, or is it all for people who live in homes they own?
Well, there's programs out there for landlords, yes. The struggle becomes also that there has to be tenant buy-in on this. But it's interesting because we're actually working on a new pilot. We do not have any details at the moment, so I'm not going to share anything beyond that. We're trying to put this in place. But the tenants are the ones that are shouldering the disproportionate energy burden. And so trying to get the landlords and the tenants to work together, because many of these grants, and this is not anything that we've designed, these are all grants that exist previously, they require income verification for the inhabitants of the property, and that can be a struggle, you know. And so part of this is trying to understand how to navigate all of this. So we're working on it.
That's great. Let's see, we have a question here. Not clear exactly who it's for, but it says, how do we pursue this work with residents from neighborhoods and demographics we're trying to help? Folks are in situations due to poverty. We're not attacking the root of those issues. Val and Mike, I'd be interested to hear what you think about, you know, poverty being the root of these issues, and you know, we're coming in above that.
Actually, I think that's a very insightful question, and actually tied to the one above it as well, about, you know, intentional action to obtain Black and brown contractor and workers to do remediation work. You know, so yeah, how do you attack like the root cause of poverty? One of the things that's happening right now is with the CLCPA, so it's a statewide act to kind of reduce New York State emissions, is that 35 to 40% of those funds have to go to help disadvantaged communities. So that can look different depending on where you're at, but there is a local organization, the Climate Solutions Accelerator, that is the hub for funding from the Inflation Reduction Act to help make sure that this money is being invested in a way that's equitable, and that, you know, people of color are having their voices heard, and also part of who are receiving these funds, as well as, you know, being the change makers. You know, maybe they're training as solar technicians, maybe they're training as contractors and workers. So it's in progress, but I'm very hopeful that people who need it most won't be left out.
Thanks, Dr. Liu. Elizabeth, did you have something to add? I saw you raised your hand.
I do. I'll just share that Renew's partners like Action for Better Community, Pastone Corporation, and NeighborWorks Corporation are all committed to meeting or exceeding New York State Empire State Development's goal of awarding at least 30% of all projects to MWBE certified firms. They all have long-standing relationships with these partners, but interestingly, we are really talking about workforce development, and we're really talking about the process of how do you get more people to get the MWBE certification, because the process is not simple. And so we are aware that there are issues with this. We are continuing to have conversations about it. And yeah, it's a concern for us as well. And we are working, you know, that is always part of our ongoing conversations.
Mm-hmm. Thanks, Elizabeth. Yeah, that was in reference to another question I know not all the attendees can see, which was what percentage of the contractors and workers are Black and brown, and is there intentional action to increase that that number? And so that's what she's referring to for the MWBE is minority and women-owned businesses. Let's see, what other questions do we have?
Andre, that just provoked something in my brain. And I feel like this is something everyone wants to come from a talk like this, not with gloom and doom, but some ideas on what they can do. And if you are in a position of hiring or power where you can move the needle in your organization, think about how you can hire people of color, or how you can change your hiring practices so that you know, inherent bias is cut down in how you decide who gets promoted, who gets hired. And that's actually something that we're working on right now in the emergency department in the University of Rochester, is like non-discriminatory hiring practices, and also giving people who are historically disadvantaged a foot in the door, a way in. I think that's so important.
Mm-hmm. Definitely. Awesome. Oh, sorry, Mike, we have a question here for you that is, what should gas utilities be doing about their rates now if we expect people to be using a lot less gas in the near future?
Yeah, thanks, Andre. So I mentioned this that we what's going to happen with the gas utility, right? If the state of New York has such ambitious climate goals and natural gas is a fossil fuel, as we heard, that causes climate change. So clearly there's some, debate about how much does gas go away altogether, how much is it, are other solutions involved, but the future is clearly less than it is now. And what we can't have is a situation where a bunch of wealthier people install expensive heat pumps and get off of gas altogether and sort of leave the burden of that legacy system on people who are unable to make the switch themselves. So we certainly need programs to help people. We heard from Elizabeth, a program that helps install heat pump water heaters in 55 homes. We need a dramatic expansion of programs like that help everyone access this kind of solution. And we need, as I said, a lot greater scrutiny on these programs where utilities are investing heavily in their capital systems. So when we see these big pipeline replacement programs is the best example, where we say, why would we install so many brand new pipelines today if we don't think we want to use them all in the future? So we need to pare back those investments and look for alternatives.
Awesome, thanks. I think we have time for one more question. This is going to be the same question. I'd like for each of you to answer it. So what role do you see for organizations, businesses in the region in an equitable transition to clean energy for this region? This is a small question. Who wants to go first?
So something actually we were discussing earlier is like how you invest your money. So, most businesses don't just have their money in the piggy bank or savings account. You have investment in stocks. And how do you divest from fossil fuel heavy industries in your investments? There's like, I use like Ally Banking, and there's like a very quick tab you just click over and you can just say, I want to invest in green energy. And I think that's a very easy way to make a difference in the organization. Sorry, my baby's not happy right now.
Don't worry about it. Thanks, that was a great suggestion. Who's next?
I'll go and leave the last word to you, Elizabeth. Yeah, so certainly if you're a business owner, a decision maker, or a homeowner, obviously you can make the decisions of what to do with your own property. You can seek these upgrades to your business to reduce your own emissions. You can transition to electric vehicles, electric heat pumps, et cetera. You can seek out programs like we heard from Elizabeth to help you afford the cost of that. But in addition, many of these decisions that drive the transition are not individual decisions, they're big systematic decisions. And folks like the New York Public Service Commission are making big decisions about the future of the energy system. And so I'd encourage folks to engage and submit comments, submit letters into the New York Public Service Commission about your priorities to help them make informed decisions with everyone's decisions about RG&E, about National Grid, about what happens in your energy systems.
Awesome.
I'll just echo everything and say that I think, modeling behavior, is a really good thing to think about. What can you do in your business? What can you do at your organization? What educational information can you provide to your employees to help them with this process? Beyond sort of, going and planting some flowers, on a spring cleanup day, which is a terrific thing to do. How do you begin to really walk the walk if you're talking the talk? And I think there are so many small steps and big steps that need to be taken. But I don't think people need to be somehow overwhelmed with somehow you need to solve every problem right now. Just look around. What problem can you solve today in your place of business? How can you begin to model this type of behavior? And I think those can be very impactful and very motivational to then be able to make bigger. Let's go back to that before and after picture of the gentleman who had the issues with his home. Once he got some help getting it going, he was able to do some more stuff. We're all like that. And I think we need to take that inspiration.
Thanks, Elizabeth. All right. Well, thank you everyone for attending. A couple quick things. First of all, we do have a website. AMPED has a website where we have case studies if you want to learn more about some of these things, information about incentives, financing, links, and also more information about these monthly webinars. So you can go there. We also have social media, especially on LinkedIn. If you guys want to follow us and reshare some of those things, that would be great. And, you know, as a next step, just remember that you can donate to Renew. You can subscribe to AMP so you can figure out when our next things are coming along. And, you know, you can think about what you can do as an organization, just like Elizabeth said. Remember, you will be getting a really short survey as soon as we close this up. But thanks for giving us your lunch hour, and we'll hopefully see you next month.
Thank you guys so much. I just clicked open the comments and saw all the incredible things that people had to share there. So if you haven't taken a look at the webinar chat, there's some great stuff in there too. Thank you guys.
Thank you. And someone asked, will we be getting a copy of the webinar? Yes, you will get an email with the copy of the webinar. All right. Thanks, everyone.